And it's kind of like, criticism begets criticism.
Yeah.
But positive thoughts are also associated with other positive thoughts. So if we can get kind of like that flip, and you can practice it, then the creativity flows, and you just see these remarkable, feats, and in a comfortable way. If you have an injury, oftentimes you're worried about getting re-injured.
Yep.
You're certainly, concerned about how, what you can do to help the healing process go optimally too, right? And, so you got a lot on your mind.
Yeah.
And that causes someone to get distracted. If they're distracted, they're not focused. If they're not focused, they're more likely to get a re-injury. So unfortunately, a lot of people, when they image like a performance situation, they'll actually start to, imagine winning or having the perfect performance and everybody's clapping. Well, that's an outcome. And so what might happen is that could lead to, a focus on kind of like things that could go wrong. It kind of drifts into your sleep, and you don't process it as well.
Hello. Today we're joined by Dr. Brad Donohue. Dr. Donohue is a distinguished professor at UNLV, author of more than 170 scientific publications, which is really, really remarkable. Spent, I believe, about 4 or 5 years or something like that working with KA, and is the director of the Optimal Performance Program in Sports. So very excited to have you. Welcome to the channel.
Pleasure being here. Thank you.
Yeah. When we were talking, one of the things that really struck me was your focus on this kind of like positivist or like constructivist approach to like performance psychology and psychology in general. Can you maybe talk to me a little bit about how you kind of arrived at this point of view and some of the merits in that approach?
Yeah, so what happened is in 2012, we got funding with a substantial grant to develop the first program for athletes for their mental health. And the athletics director at the University of Nevada, Las Vegas, where the study took place, had asked me if we could kind of develop from a performance standpoint. And he thought it could be more relatable with the athletes. What was happening is they were going to campus counseling and they were dropping out. They'd go there because the first meeting, they'd have a mandatory meeting that they'd have to do. And then after that, they couldn't mandate them to go into therapy. So they would drop out. And I think it was because they weren't relating. It was very it was traditional kind of programs or interventions that they were doing. So we took a very different approach where we started to focus on performance situations and then try to optimize their thoughts, their actions, their perceptions while they were in those performance situations. And so that was kind of innovative because, to that time, if you were working with athletes, not only were they not like sports specific or performance specific, but they also had a tendency to try to reduce pathology. Like there was an assumption that someone has a problem and we're going to go ahead and solve it. And so we took a different standpoint. We believed that if we were truly going to reduce that stigma and encourage people to be engaged, that, there shouldn't be a look at pathology. That certainly shouldn't be the thing that guides them into our program. What we really wanted was to work with all athletes at the time, anybody that just wanted to improve their performance in sports and in life. And then, we were very successful. The outcomes from the clinical trial that we did showed that we, doing this approach, we could improve their mental health, their relationships with teammates, coaches, and family, and also their sport performance as well, like factors that were interfering with that. And it was about that time that we started getting that information out that I got called, by Al Light, who was a head trainer at KA. And then he thought, well, hey, could you apply this to our artists? And, because we believe that, a lot of the same things that you were experiencing with the athletes are true of artists. And, of course, there's a lot of cultural differences. And,
absolutely.
The outcomes are a lot different, but there are similarities. And so we tried it out and it was pretty successful.
Yeah, absolutely. Like one of the very characteristic things about Cirque is that you are getting artists from all over the world. You know, in particular places like Russia and China sometimes, which might have like very different cultures from us. And past that, there's this extra level of selection of like, these are a lot of times like Olympic athletes or athletes who've had a like a pretty established career, gone through a lot of things, and are starting to develop an artistic side that they might not have already done, and might already have some like preconceptions about like what it takes to like succeed in these contexts. Can you talk a little bit about you know, how receptive some of them might have been to your message, and maybe just your kind of observations about like how this population differs from, you know, like a university campus?
Yeah, well, I do think that there's a lot of similarities in terms of the mental health aspects, you know. However, I actually think that, you know, with artists, they're actually, you know, more under the microscope. There's more of an evaluative component to their performance situations that are outside of their control. And, you know, if you just think about, you know, that they're performing to an audience, it's very difficult. Like, you know, some people might like something that they're doing on a particular night, and, you know, just another random person might not like that. So that makes it very difficult for the artist to try to, you know, please everybody. And oftentimes there's also a culture, perhaps even more so than in sports, where, you know, because there's usually a group of artists that are working together to accomplish, you know, an amazing feat that no one else has done, perhaps, that, you know, because of that, there's limited time. And so you oftentimes have the coaches that get right to the point, you know, don't do this, or, you know, you need to do this, you know. And like if they're using words like need, that's a pressure word. And and then if they're going right to the point of what they're doing wrong, they have to kind of convert it in their mindset. And a lot of the artists, they become desensitized to that to some extent. But, you know, generally speaking, that's always going to be a conversion that they're going to have to make mentally that does, you know, delay the learning process. It kind of interferes with creativity sometimes. So, you know, we tried when we were working with Ka and then some of the other subsequently, you know, some of the other shows, is to try to get the, you know, the trainers, the head coaches and the coaches to, you know, really focus on what they were doing, you know, in a good way, what they did optimally, and and then excuse me, and then try to see if they could, you know, from that strength, what could they do to optimize the performance further? And that's what we did with the athletes too.
Yeah. What was that process like? You were brought in to like work with Ka. Was that to like work with like, you know, coaches up and down, or was the primary intention to work with athletes, but you identified that, hey, like this communication model is important, and then you're advocating for like, you know, maybe talking to coaches about the ways that they, you know, approach these conversations?
Yeah, it was a very difficult situation. What had happened was they had a fatality, you know, and there was a lot of upset, a lot of finger pointing, a lot of concern, confusion, you know, so there's a lot of that happening, depression. And so when I came in, you know, it was a different culture for me just in general. But on top of that, there was, you know, a lot of remorse and you know, just a lot of confusion. And so, you know, so that was a very different, I think, approach than what would happen typically, you know. But like earlier to what you were saying about cultures, you know, if, you know, say, for example, a Russian artist or a Chinese artist who had, you know, maybe been exposed to more traditional programs, you know, therapies, you know, that are focusing on problem behaviors or depression or anxieties and things like that, you know, if you don't have an artist-specific kind of approach to that, you know, you're going to have some difficulties kind of bringing what you have into it and kind of making that work. And so I think we had an edge that way, in the sense that our program was really focused on whatever their situation was, that we were going to focus on what they were doing right, how they were thinking right, how they were acting right, how they were perceiving right, and then try to see if we could optimize it from their perspective. And that kind of kept it in a way that we really had some, I think, positive gains.
Yeah. When you're talking about those gains, are there particular like skills or attributes that you're really working with people often on? And are there like some go-to tools in your toolbox that you use with these performers?
Yeah. So what we did was, first off, we started to have open forum groups, where they could come in or they can go out, however, they felt comfortable. And then what happened was, I think especially initially, some of the administrators, some of the coaches, they had, some of the people that were well trusted, and had been around for a while. They would come into those open forum groups just to kind of check out what was going on, and then kind of pass that on to the others if they felt comfortable with that, if they felt that it was going in the right direction, that kind of thing. So there was definitely a period of evaluation for me to make sure that I was, someone that they could trust. And I think, we did kind of move forward on that, and perhaps even quicker than I had thought. And then, then what happened was we started first with identifying situations that would be something that would be, performance-based. For example, in CAW, there's, that
vertical stage.
Exactly, that vertical stage, they're going to go up that, and that's very anxiety-provoking under the circumstances. And so, we started to take other performance situations that were perhaps a little bit easier than, thinking about that, and started to work on the way that they were thinking. And we have, in the Optimum Performance Program in sports, we have a number of different ways that you can think non-optimally and optimally. So, for example, an outcome thought might be, I'm going to get to the top of that wall. There's going to be no problems. Whereas, like, a process thought would be how you're going to get, to the top of that wall. And if you can just think about, life. The way that we, go about performance is very similar, whether it's in the arts or if it's just, out in the real world. Like, filling your tank up with gas is actually, if you think about it, there is an evaluative component. I mean, you could miss and the gas goes on the floor. It's just that's not all that difficult of a task. And perhaps there's not as much on the evaluation, but nevertheless, there is a performance that you have to do there. With these feats that they were having to do, they're extremely difficult. So the anxiety rises up, the outcomes become, more important and potentially dangerous. And so obviously that leads people to, have distorted thoughts or dysfunctional thoughts or thoughts that kind of, aren't as clear. And so we focused on how we could get those more optimal thoughts, how to think about the processes, how to remove pressure thoughts. Like, a pressure thought would be like, I need to, I must, I should, and instead replace those with I want to, I'm going to, that kind of thing. And we have just, like over a dozen ways of thought patterns that we could identify. And then if they can enhance or optimize those thoughts, then we started to work on actions, and certainly anything that we do can be observed. And if that can be observed, we can optimize it with practice. And so we worked on that. And then lastly, we worked on perceptions which like in mindfulness, which is very common nowadays.
Sure.
People will focus on, perhaps pay attention to the moment, that they're in, the here and now, the present. And, then you'll kind of experience all the different senses, right? What you see and hearing, smelling, tasting, et cetera. What we started to do was a little bit different. We really started to focus on the perceptual aspects of that. So not just the sensation and just kind of, focus on whatever that might have been, but try to identify relevant sensations and then convert that information into something that's going to benefit them, something that's really positive. So, so for example, I see, my coworker on the stage, and she brings a feeling of comfort to me. Mm-hmm. So we're taking advantage of the sight, what we're seeing, and then kind of converting into a good way.
Yeah, you're building an association. So like Happy Gilmore, like the Chubbs or whatever, like telling Adam Sandler's character like to like go to his happy place, like before he does a swing type of thing.
Yeah, that's outstanding. And if you think about it, if you start to get in that habit, then everything becomes more of a positive perspective. And the beauty of that is that then the person could actually start to look at difficult situations in a completely different way, a way that they're more comfortable. Mm-hmm. And when you're comfortable, you can get more creative. And I think that's especially important in the arts. And so, because they can really get going.
No, that's a really interesting thing. And, in partner acrobatics, particularly like in the recreational world, sometimes people have a dedicated partner, sometimes they won't. There are these feelings of anxiety, fear of doing a skill, like questions like, do I trust this person?
Right.
If you were, giving non-clinical advice or whatever to, someone who's struggling with something like that, what might that be in terms of like a combination of like exposure, building up, those kind of like positive associations with either the environment or the individuals, or how would you go about that?
It's interesting, right? Like if you have a partner, technically, what that partner is doing is outside of your control.
Right.
So it really becomes very important to think about yourself and what you can do, think, and perceive, and really focus on that. And that's the part about, the trust, because the trust really is completely thinking about another person and what, they're going to do. And then you have a reliance upon it. You're really hoping that that's going to go through. So that is a hard one, right? Mm-hmm. And so the easiest way to kind of do that is that you can think about it almost like if my performance is optimized, if I'm thinking clearly and doing, all the right moves and, and I'm perceiving in a really good way, I increase the likelihood that my partner is going to be successful. Yeah. And so that's probably the best thing that you can do is, be concerned about yourself, right, and really try to optimize that to some extent. And then the other thing that becomes interesting then too is in between, practices or in between shows, to have good communication. Yeah. So that you feel comfortable talking to the other person. And one of the things that happens is you get this trickling down effect a lot of time in the arts where, like a coach goes right to what they could do, to improve, right? And, and the problem with that is they're not being recognized or acknowledged for the positive things that they just did. So if you think about it, in some ways, the focus now becomes on the mistakes and, and avoiding mistakes. And so that's where I think it also comes into developing communication habits where you start to think about not only yourself identifying the things you're doing, thinking and perceiving, in an optimal way, but then also doing the same for your partner. So recognizing, acknowledging, hey, I really liked how you did such and such, and then maybe giving them the benefit of the doubt. What did you like about yourself? And is there anything you think you could have done to optimize? 90% of the time, the partner is going to get the right answer anyway. And then you just have to say, well, maybe we'll focus a little bit on that, but I really did like how you did, such and such. So that would probably be maybe what I would throw out to try.
No, and like that's definitely like something that like actually feels better. But when it comes down to the game of like skill acquisition, like the mental state that you're in matters a lot, as well as just like where is your focus, not just like internal, external, but like, if the first thing you talk about is like the mistake or something like that, you can get like a purple elephant effect of like, don't think about a purple elephant. Like
that's right.
Can you maybe talk a little bit about like maybe some of the other factors or like other compelling bits of evidence kind of along that line?
Yeah, like so if you think about that, what I've been talking about is like, the thoughts, the actions, the perceptions.
Right.
And, the main thing about that is that we believe, in the approach that we're taking, that, whenever an athlete or an artist is out there performing, we have to go with the assumption that they're functioning optimally in that moment. And how we define it is doing, thinking, and perceiving in the best possible way, given your current skills and your current resources that you had available and the demands that were upon them, from the environment. And so if you think about it that way, we're going to make an assumption that they are functioning optimally. Even if a mistake is made, it may not have been as good as the time before it. But generally speaking, we're going to go with the idea that, for whatever reason, there was something else going on.
Yeah, there's some kind of environmental constraint that, that was the solution to.
Right.
Yeah. And
so if you then start to think, okay, what did I do that I thought was essentially optimal? It just makes it easier to kind of step up incrementally to think of the next time, what am I going to do to manage this, so that if this environmental context or this skill deficit, this injury, whatever it might be that interfered with that performance, what is it that we can now, do that's going to rectify that? And we do that through skills. So we actually do exercises. One of the things that we've been doing is we notice that a lot of times artists in particular have a tendency to go to the things that they could enhance, and that usually means that they're thinking about the things they're not doing right. And so we try to get them into the opposite way and to bring about that creativity by having them practice thinking of positive things about themselves, true things that they sincerely believe that they do well. So, I don't know, give me some examples that would come to your mind if you were performing. What would you say that you do well?
I think character work is something that I do pretty well.
Beautiful.
I think I'm like pretty strong, and like I choose, skills and even like ways of doing skills that kind of like showcase that strength.
Excellent.
Yeah.
And so those would be two things, right? But from those two things, now give me a few other things that are related to those things that you do, like maybe behaviorally, or you do with your thoughts along those lines, or the way that you perceive along those lines. Can you think of anything else that is related to those two things that you just mentioned?
I think I enjoy like clowning and like kind of, using both of those things to like be able to connect and interact with the audience more. Beautiful. Because, things are either easier for me, or like I don't have anxiety, and like I can put some things a little bit on autopilot, and I can focus on like what's actually happening.
Yeah.
Yeah.
Beautiful. So there you said you don't have anxiety. So we would just flip that to calmness.
Sure.
And then we would add those two or three other things that you just mentioned, and then kind of like package them.
Right.
And so now you start to think about all those things together. So just out of curiosity, can you do that? Like list them all off, all the things you just said? So you had two things initially, and then you just came up with a couple of other things.
Right. So I had like character work, I had strength. I talked about like clowning, being able to connect with the audience, and then what you had recharacterized as calmness.
Beautiful. And you saw how quickly the second time it was much quicker, wasn't it?
Right. Yeah, absolutely.
Like as soon as I asked you, you just kind of listed them off, and it was very calm too. The way that you said it was very, and that's practice. So we'll actually do the same thing with the artists, where we'll start to, get them thinking along the lines of the positive things that they're doing, thinking, perceiving, right. And they just kind of imagine it in different scenarios. And then, that kind of makes it so that they're on the top of, the tip of the tongue, so that if they're performing, now they could think of all their skill sets very quickly. And we found that that's extremely helpful. And it's kind of like, criticism begets criticism.
Yeah.
But positive thoughts are also associated with other positive thoughts. So if we can get kind of like that flip, and you can practice it, then the creativity flows, and you just see these remarkable, feats, and in a comfortable way. And I think that's what we also did when we did those initial trials with the athletes.
Yeah, no, that makes a lot of sense. Do you distinguish at all between kind of like a performance environment and like, potentially multiple different types of practice environments, right? So you might have like a dress rehearsal for a show where you expect to hit everything, but then you might have like more of a creation process, or like an artist who's learning a new apparatus where there is going to be more, quote unquote failure. Like are there kind of different lenses you might use for those situations?
Absolutely. And so what we do in all those situations, we start first with a performance situation that they recently experienced.
Okay, yeah.
And so they disclose that to us. And then what we do is we actually ask them, okay, where did that performance situation start? Mm-hmm. And, so if it is a dress rehearsal, that's a performance situation. Where did that dress rehearsal start that you believe it became a performance? And so then they start there. And then we just have them describing that situation, like whatever they're doing, thinking, perceiving, they just start doing it sequentially.
Yeah.
And as they're doing that, the optimizer goes ahead and just simply, does something like what you would see like Muhammad Ali, his crew doing, for example. Mm-hmm. They say, and I'm feeling calm. And then I would say, you're darn right, you're feeling calm, you're collected, you are the person, you are within yourself in the best possible way, say it. And mm-hmm. then they'll say, and I'm doing remarkably, I'm feeling it. You say, yes, you are. So you're kind of backing them up, essentially reinforcing them for having these wonderful thoughts. And so what we're doing is, as they're sequentially describing what they're doing, thinking, perceiving, we're kind of piggybacking off of that, saying mm-hmm. how wonderful it is, reinforcing that. We're also priming them to think in certain ways. So I might think, I might say something like, what are your thoughts right now? And they'll disclose those thoughts. And if there's a non-optimal bent to it, like maybe they say, I'm feeling okay.
Yeah.
We'll say, you're feeling amazing. You're feeling like this is the day. Say it. Mm-hmm. I'm feeling amazing. This is my day. Right. Beautiful. You see, so we're kind of like optimizing their thoughts in real time mm-hmm. Through their imagery. And then, when they get out there in the real world, they're practiced at every little nuance, that goes along. And of course, you've got to do the physical, right. Right after that to get all those movements in a certain way. But at least that's how we mentally prepare them, with those exercises.
Yeah, no, yeah, that makes a lot of sense in like a performance context. I also see like a lot of things you can take away from that, like in a partnership dynamic where it's like, okay, like we're about to train and things like that. Like, let's, be in a good state of mind in order to bring about a good performance.
Definitely.
When you're having like, kind of like more difficult conversations, if someone's saying like, I'm feeling okay, like in a performance situation, you want to talk them up, like, no, you feel like amazing or whatever. But other times it's like, you might want to validate or like dig in a little bit more, particularly like as you're coming into like Ka and like there's been this fatality and people are in a little bit more of an emotional kind of like raw place. Yeah. How might you, approach those conversations about like either that or maybe like some kind of like traumatic injury?
Well, that's extremely insightful, and you're spot on that. And see, the beauty of it is if you take a performance situation and you ask them, what is the performance situation that you want to talk about? And then they disclose it. And they say, okay, where does that performance situation start? Again, they're driving, that scenario. Mm-hmm. And then what's going to happen is they're going to have what they consider to be optimal thoughts, actions, perceptions as they're sequentially describing that. Right. And so what's wonderful about it and what makes it culturally relevant is that they're telling you, where they feel they are optimally at that moment as they're disclosing that stuff to you, and you're just kind of piggybacking off of that to try to optimize those experiences, by throwing out some ideas for them to consider, maybe even, literally telling them, I want you to try this to see how that works out. And just like anything, they may feel uncomfortable, going to that next level. And, but you want them practicing that. truly, if it is an optimal thought, action, or perception that you're throwing out, that like a softball, you're kind of giving it to them, then then the integrity of it will come out. If they're not ready for that, they just won't say that. But usually they do. They know, because you've already gone over non-optimal and optimal thoughts, actions, perceptions with them, previously. And now we're just practicing this imaginally. And so they kind of are already bought into it. And now they're just practicing it.
Yeah.
Yeah. And we do have some other exercises too. Like in one exercise, a lot of times they might get triggered by something. Let's say someone had a bad accident and they got an injury from it. Well, when they are ready to get back and trying out that act again, they might have anxieties now that have built up. And, in those cases, we know that the greatest way to get through that is exposure. But of course, that's easier said than done. And so what we'll do is try to, do like imaginal exercises like I was just describing. But then eventually you have to actually get out there and, and try it. So if they go in with this refreshed, optimal mindset, they're more likely to be able to do the right thing, which actually prevents further injury, because now they're cleared up in their head, they're thinking neutrally or objectively, and we're gonna gradually build that up. So that might speak to what you were saying earlier, is that if the artist isn't ready to go with "I'm feeling amazing," maybe okay is optimal at that time, they'll do it. But we want to try to at least practice what would be the optimum, in terms of doing, thinking, and perceiving in the best way to get their outcomes, achieved, without focusing on the outcome itself.
Yeah. So I think like you've talked a few times about like doing things and perceivings, or like, actions, thoughts, whatever you want to, however you want to phrase that.
Yeah.
I think that actions and thoughts are more or less self-explanatory. We've talked about like kind of cognitive behavioral therapy type things that you can use towards the thoughts.
Yeah.
When it comes to perception, I'm a little bit curious as to what you mean exactly. So one thing that I think a lot about is, like what specifying information in the environment are you paying attention to? So like if I'm doing like partner acrobatics, I'm like paying attention to like where my flyer's like hips or feet or something like that, if I'm going to be throwing them or catching them.
Yeah.
But I imagine that there are other, things that might go into, the broad bucket of perception from a performance standpoint.
Yeah, well, that's a great point too. And, so when you're in the heat of the actual performance situation, the best thing, of course, is that you're not thinking. It's just the flow. And if you think about it, you've practiced it maybe hundreds of times.
Yeah.
Now you're actually doing it. So you really want the body, and the mind just to get in that flow. There's no thinking going on. So the things that I'm talking about are like kind of like the antecedents, or it's what comes before you actually perform. So it's kind of like having those thoughts, maybe, throughout the week, periodically, or at set times, or just before you go to sleep, those kinds of things. And, that when you actually get out there and it's the show and you're ready to perform, the mind ideally is relaxed, calm, collected, and your arousal level is already, meeting, wherever you need to be at that point.
Right.
And you just kind of do it. So that's what I would say about that. You're just already into it. If you're in the act, you're not really thinking. You've already done your thinking and practiced that, just like you had practiced the move, maybe hundreds of times as well.
Yeah, no, and there's, I think, a big parallel, between kind of all the performance arts. So I have a background in music, and if you're playing like a fast orchestral passage, or like a technically complex syllables, if you're thinking about like what's going on technically, you're completely lost.
That's right.
Like you want to be in that, that piece can be automatic, but I've found, at least personally, like I don't necessarily want to be in flow state as much as like I want to be thinking about higher order things of like, like what am I, you know, so one level of it, like if I'm playing music, is like, okay, like what is it sounding like? How is the audience seem to be receiving it? And then another level is like, kind of where do I want to go? Because like I know technically like what I'm doing there, I have like an interpretation of the piece, like roughly in my head, like I think these are the important things, but like no performance is the same, right? And like there's going to be like slight differences, or like there might be like an emotional thing. I mean, there might be a note I want to lean into a little bit more, a little bit less. The hall might sound a particular way. And similarly, when I'm performing, you know, like we might be a little behind the music, a little ahead of the music. The lights might be a little off. There might be like audience might be a little bit more over here. Like there's kind of a lot of things that are going on that you know, I might want to acknowledge or play into in some way. Like do you have a, I don't know, like a framework or a you know, have you had these types of conversations with artists?
Well, you know, definitely. And they usually come in the context of the practices that we're doing, you know. So like, for example, just to throw it out, what you were just saying, would you see how the things that I was saying complement what you were just
absolutely.
saying? How would you say that would complement what you were just saying?
I think that having the right mindset, and then also just being in the way, you know, in a place where you're not thinking on what's going on technically, enables you to have these higher order concerns. Yeah,
that's right. And so, you know, in that situation, you know, we all know that like, that's kind of like what makes the difference between an amateur and a professional. It's what makes someone, you know, go from, you know, a novice to an expert. You know, like there's always going to be that enhancement, and those are going to be the things that are going to be relevant to you know, you just, you know, optimizing your situation. You know, you're going to have that experience, and so you know, like there's not as much that you can do along those lines, you know, because once you're in that moment, you know, it's going to happen, and you're going to make your adjustments, and then afterwards, you know, we might talk about what your experience was like. And you might say, well, you know, when I got in there, the audience was very flat, and you know, you know, I had to try to brainstorm very quickly what I would do a little differently, you know, to meet them on that. And then so, you know, at that point, now we have time. You know, you didn't have that at the time, you know, when you were actually doing that event. And so that would be consistent with what I was saying. You did optimal given the constraints, the constraints you had, and that was from the audience. You know, it was something that maybe you didn't see. And so we would talk about that. We would make our adjustments, and then we would just, you know, kind of image, you know, the adjustments that you would make, so the next time you would go in there, you'd be more prepared, you know, and that would be experience. You know, you get more and more, you know, optimal in handling that. Now, another thought though is from the observation of other people too. So you might see another performer who's you know, trying to do the same thing that you're about to do. Well, you're looking at the audience, you're making your mental notes, and so you can kind of prepare yourself that way as well. You know, so it's definitely, there's a, you know, a give and take here that you know, you've got to perform, and like you said, it is very different. There's something going on a little bit different, but the more that you prepare for it mentally and physically, you know, the better shot you have at having that ultimate performance that you're looking for.
We've touched a little bit on injury. I want to focus on it a little bit more, because it's, you know, kind of an unfortunate reality of really any athletic endeavor. Like if you're using your body, like at some points you're going to have some issues with that. Can you maybe talk a little bit about the, you know, how, you know, particularly for artists or like acrobats, like, you know, the effects of injury that go beyond just like your body's hurting, like the loss of connection, things like that. And then when you're approaching reintegration, like what, you know, steps and strategies are you using?
Well, you know, the thought there is that, you know, if you think about it from a psychological perspective, if you have an injury, oftentimes you're worried about getting re-injured. You're certainly, you know, concerned about how what you can do to help the healing process go optimally too, right?
Mm-hmm.
And, so you got a lot on your mind. And so when you start to, get back, into it, and you're now trying, whatever the act was before, that's now in your mindset a lot of times.
Yeah.
And that causes someone to get distracted. If they're distracted, they're not focused. If they're not focused, they're more likely to get a re-injury. And so that's a big part of, trying to think about getting them back to how they used to be, not just physically, so, the trainers are going to really be helpful for that, of course, and you're going to follow through with those kinds of things. But mentally, you can prepare as well, in the same way that I was just describing, where you look at your performance and you kind of visualize it. If you're lucky enough to have someone that's working with you, that's kind of listening to your thoughts objectively and trying to provide you that information so that you could, clear up any non-optimal thoughts you might be having, that kind of thing, then that's great. We do a thing called dream mapping as well to help with that process. And so, if me and you are kind of having you image a performance situation, like getting back in and, trying to do the same things that you used to do, what we can do is we have you, kind of image, what that performance is going to be like. And then when I feel that you are getting it, good enough and you're really seeming to come back mentally, you've got things going on in a good way. You don't have these distracting thoughts and that kind of thing. Then, and you're removing the outcomes. So you're no longer thinking about the outcomes, but you're actually thinking about the processes very cleanly, and that's what you're focused on. Then we could have you do this exercise yourself before you go to sleep. Mm-hmm. And what we found is that, and it's just anecdotal, but there's some evidence to support it, that when you have that performance where you're just focusing on the processes and not the outcomes, then what ends up happening is you carry that into your REM sleep, and you'll actually have your situation will be kind of processed. And we found tremendous benefits from that, not just from injury, but also for any kind of performance. And the trick is to have them not think about the outcomes. So unfortunately, a lot of people, when they image like a performance situation, they'll actually start to, imagine winning or having the perfect performance and everybody's clapping. Well, that's an outcome. Mm-hmm. And so what might happen is that could lead to, a focus on kind of like things that could go wrong. It kind of drifts into your sleep and you don't process it as well. Yeah. So that's a big part, is kind of removing the outcomes and just really focusing on the processes when you're going to be getting back into, doing whatever your act was. Trying to think of some other things that we do for injury management. A lot of it too is just to have those confident thoughts. If you've been okayed, so to speak, cleared, that you're, that it's okay to do. There's always going to be a little bit of inhibition, and and wonderment as far as if you can get back into it. And to the extent that the more of those kind of thoughts you have, the more likely you are to get re-injured. And so we try to bring in a confidence too, so that they feel, that when they've been cleared physically, that they're going to be mentally strong, in terms of those thoughts, so that it kind of becomes incompatible with any of these nervous related thoughts that could, distract them. Yeah.
So can you maybe like give some tool, like maybe a specific exercise you might give someone who, let's say they had like, let's be specific. So like say they were a flyer, they had like some kind of fall and they had like an elbow or shoulder injury, and might now have some hesitation or anxiety associated with like dynamic skills, or they're being like thrown or caught through that handstand and are worried maybe like some kind of buckling might happen.
Right. Well, every case is completely different, right?
Sure.
But in general, what you'd want to do is try to find out the way that the person's thinking about, the reentry. You'd want to find out the kinds of thoughts that they're having specifically. Definitely, if they're perseverating on particular sensations, and too much. And we basically want to try to find out all the factors that are in their mind that are interfering with their objectivity. And then once we find that, then we want to increase the likelihood that they're going to be able to think objectively, but with a positive bent to it.
Yeah.
And, and that, obviously that's involved, but it is fascinating. Like you'll see that people who recover well to injuries, they're also, they have this positive mindset, this positive perspective, just in general in life. And so that's kind of like what we're trying to do with, say, for example, the TOPS program, is get them to, be thinking objectively but with that positive bent. And then, they, become more resistant to injury, number one. And then if they get injury, then they recover better because they're able to focus a little bit more.
Yeah, no, and at the very beginning of this conversation, you touched on how this, like, this approach is effective for sports, but like it also, gives people the skills to like have better relationships with their families and like perform better in other aspects of life. Can you maybe like go a little bit more into like those benefits and maybe some like anecdotal experiences you've seen of like, hey, you're working with, like athletes or coaches on some of these skills that are, ostensibly to like help them do their job or perform better, but it's helping everything else as well. Yeah,
like right now, and remind me, by the way, I'll try to talk a little bit about diaphragmatic breathing and some of the benefits of that and how to do that in the right way. And but yeah, like in terms of feedback, I think you bring up a great point. You're going to be working with the coaches. So the coaches, you want them really focused again on the positive, things that are going on, so hey, I like this. What did you like about what you did? What would you see that you could do to optimize that experience? And then lastly, the coach, if it hasn't come up about what they could do differently, then the coach finally says, would you like to know, what I have? Or they just simply say, well, I think if you did this, it might help out too. Mm-hmm. But first we're putting the priority to the, to the performer, the artist, to say, what did you like about what you did there? Anything you think you could do to optimize it? I like these things about it, and it might just end there. And if it doesn't, then, if you think there's really something that's going to benefit you, if you're the coach, then benefit the, the performance, then you could, throw that out. So there's an emphasis, in the recovery phase, whether you're the, the person that's involved in that act, a partner, or you're the coach, or even if you're the same person, all gets to this idea that you're trying to first recognize the things that you're doing, in a positive way. And then, you try to think about the, the things that you could optimize after that, so it really establishes a firm foundation, so that's a kind of like a strategy that seems so simple, but I see it being violated all the time, And then the thing I was going to say about diaphragmatic breathing and relaxation is just that, like, a lot of people don't really know how to do this. I mean, the really good ones do. A lot of times people that are doing yoga, but really, if you think about it, when you're breathing diaphragmatically, your diaphragm, which is located right about here, is the thing that's really the muscle that's essentially working, to go ahead and to help you out. And the thing that's interesting is if you do diaphragmatic breathing, the body's sending out a message that I'm calm. If you do lung breathing,
breathing in the chest.
It's actually sending out messages to the brain that, okay, I've got a fight or flight going on here. I got to up my arousal level. And anxiety has a tendency to escalate. And so it's always better when you're trying to get back from an injury, because there is going to be that natural inclination to be anxious. So you want to do the diaphragmatic breathing. So the way we teach it is we have someone put their a hand on their chest, on their diaphragm.
Yep.
And we want them to really try to see that if they could get that air to go straight down past the lungs and into that diaphragm, so the diaphragm can do its work. And so, for instance, I'll just model it, but
yeah.
And so what you should be able to see is that my chest is not moving, my diaphragm, is protruding outward as I'm breathing in.
Yep.
And then as I'm breathing out, it's going in. And at first you literally have to, purposely do that. And then, eventually it becomes more normal as a process. And if you could walk around just diaphragmatically breathing while you're doing the movements, you start to coordinate that to where eventually, if you're, say, for example, in an act and you could be diaphragmatically breathing, it's just better for your, it reduces fatigue, it increases calmness, it increases concentration, so it's just such a great skill to get, and it's definitely related to injury management.
For sure. What I also really love about that example is, you're a psychologist, but you're the director of the Optimum Performance Program in sports, not like the Sports Psychology Institute. Like there's an implicit acknowledgement there that there is more than just like these kind of like cognitive like interventions, like you're talking about breath work. Can you maybe talk about kind of how you're holistically looking at performance, both as like conceptualizing it as well as like the work that you're doing with TOPS?
Yeah, well, so like maybe some of the content.
Yeah.
Okay, so like we do all kinds of exercises. We'll have some fun, establishing like a baseline. Like how many positive things could you say about yourself in a minute? And what we find is that like an adolescent can, that maybe is just getting started in sports, you might see that person do about, 4 or 5, maybe 6. And, someone that's been doing it for a while that seems to, be pretty good, they'll get up to 7 or 8 or so. If you bring it up to an adult, you start to get around 10 or 11 with an average, artist. Sometimes you'll see exceptionally that'll get up there into the early teens or whatever, but it usually is not anything more than that. And so that's an interesting exercise. You could try that out yourself and just see how many words you can say, positive words about yourself in that minute. And if you can get those words up there, then that's great. And so we talk about positive vocabulary. And you want to get that positive vocabulary about 30 or 40. I did it with a UFC guy one time, and he had like 47 that he was able to spit out there. And the guy just, he had ice in his veins. He was just so positive. He was always thinking about the positive aspects. I think that a lot of times, like, artists actually have a hard time, getting that out, And so that's one exercise that we like to do. You were going to say something about that, or you seem like that?
I think there is like an interesting like difference between like artists and like, traditional individual or team sports, but I want you to kind of keep going where you were going.
Yeah, and I think a lot of that reaction that you had, for example, might also be right, that artists, you don't want to be, outwardly at least telling people, oh yeah, I'm great, I and all these positive things. And so they get punished for being that way, almost cocky, But remember that this is inside your head, and it's very, very important to have a really strong foundation so that you can be more creative. One positive word is associated with many other positive words. So if you can get one extra word on your vocabulary, it's going to lead to a whole bunch of others, and it's contagious, just like criticism is. So that's one thing that we do. We have another exercise that's really cool where we, if someone gets into like a stuck point, they just can't seem to figure out what's going on here. Well, and Al Light likes this a lot at Cirque. Basically, we show them, we take the performance situation, we say, hey, there's things that are going on during that performance itself that are going on during that performance. There's also things that are going on seconds before, minutes before, and days before.
Right.
On the other side, believe it or not, there's things that happen seconds after the performance, days after the performance, or minutes after the performance, and days after the performance. So it's kind of like, on both sides. And we found that like the things that happen after the performance oftentimes lead to choking. So they'll do poorer, in their future performances if, for instance, they start focusing on the things they did wrong, or they focus on maybe an injury, or essentially the negative things that are going on. On the other side, you've got your routines, and if your routines are off, you know what I mean, or you're not focused enough, then you'll see that influence performance. But everybody's different, and so what we do is we have them identify the time period, one of those time periods that they feel is impacting their performance the most. And then let's say it's seconds before.
Sure.
Then what we'll do is we have a listing of different factors that could, seconds before that performance, have impacted it in a good way. Or it could be in a non-optimal way. And some of those factors are routines, arousal level, communication, physicality, and so we'll have a whole list of things, and people can kind of do that, like you can kind of generate those lists, or for instance, they can go to topscience.com, and then we have those instruments out, and we can give them out, for at no cost, and so those are, some things that we could do along those lines. One of the things that we've done is that if you can identify an early stuck point, like where your performance is being impacted, we've taught them how to say focus, and then they do diaphragmatic breathing.
Right.
And then they start to creatively think about what the solutions might be. No thinking about if those solutions are good or bad, just throw them out, get that creative process going. And then once they've identified the things that they think are going to work, we then have them imagine doing the solutions that they generated. They imagine them themselves. And then we actually have them have someone that loves them in their imagination, reinforcing them. Saying, hey, you did beautiful. I was really proud of you, stuff like that. And it's just kind of like a sequence of events, and it works beautifully. And we call it the self-control. We also have programs where you could identify people, places, and situations that have been associated with goal-oriented thoughts, actions, and perceptions, and then people, places, and situations that haven't been. For example, someone that might like to party a lot would be on that list of, goal-incompatible, people. Drinking alcohol, for instance, might be on that list. On the other side, though, we might have like doing your thought exercises, or people that are living a clean life, maybe people that don't party as much, things like that. And then if you kind of track your time with those experiences, and then what we do is we just kind of have them think about, what did I do, think, and perceive when I was with that person that was optimal? And was there anything I could have done even more optimizing, And that's just another exercise that we'll do to kind of, get them thinking. Trying to think of some.
One of the examples that you gave in the talk at the Circus Meets Medicine conference recently was you had this kind of like relaxation routine, and then you kind of ended with like emphasizing the word calm. So you were helping people achieve a particular physiological state, but then you were also trying to like build some association that you could then use later. Yeah,
beautiful. And that's especially good for people that have anxiety, or they are trying to return, to do their act again. And so with that one, what you do is, say for example, you sit down, and you maybe you're on the bed, or you're in a chair that's comfortable, and you start to do your diaphragmatic breathing. And so once you get your breathing down, then what we would do is kind of have them just imagine from the top of their head, their forehead, their eyes, their nose, their mouth, kind of like this band of relaxation coming down into their shoulders. And there's, hundreds of relaxation,
kind of like a body scan type of,
Exactly. And there's lots of that on the internet, the YouTube, right? So you then kind of do that. So it's diaphragmatic breathing. Then you kind of have your body scan, going from the top, maybe down to your toes. Then when you're in a relaxed state of mind, you actually bring in a cue word. And, that cue word will be associated with relaxation usually. So it might be relax, calm, things like that. And what you're doing is you're pairing that word with your relaxed state, in body. And so then what happens is when you get into situations that are potentially anxiety provoking, you bring on that word.
Yep.
And that word, because of the many trials that you're doing at home, perhaps like every night, or maybe in the daytime if you have that ability, while you're thinking about those positive, while you're having, that relaxed state of mind, and you're pairing the word calm, now when you get the anxiety provoking situation, just bring on calm, and it helps the body to relax.
Yeah.
Through the association.
Yeah, no, and I, prior to hearing about your work, like I've done something very similar consistently through my life. So like if I'm doing like a heavy lift in the gym or like going for a PR, like it's always Till I Collapse by Eminem is like, I'll play that song and I'm like instantly like in that like appropriate state of arousal. When I'm performing with my performance partner, like we have like a little backstage ritual that like, like kind of like a secret handshake type of thing. And it just like, very quickly puts me in the right mental state.
Beautiful.
I work at home. I have like, I have like multiple pairs of headphones. This is the one that I wear when I'm working. And I've generally kind of without consciously thinking about it, kind of associated like particular rituals, sounds, or objects with tasks. And I found that really helped me with like preparing for a particular situation. Do you, do you go through that as like a process with any of your like, performers or athletes?
Yeah, to find out what kind of things maybe help them to relax or to get positively aroused.
Yeah, or even as a strategy of like helping people like achieve a particular physiological or mental state in a particular context.
Yeah, without a doubt. I mean, that's just something that comes in naturally, organically in the process. Like as you're kind of taking these performance situations and, and trying to bring in the thoughts, the actions, the perceptions that are optimal, they'll inevitably bring up things. Hey, this is working for me. Here's something I want to do. And in fact, we'll just integrate it directly into it. So I'll be reinforcing it. So for example, what would you say, like if you were to think about that in a performance situation, or just before a performance situation, what would it sound like if you were to say that as an example?
We normally do it kind of in silence just because like you kind of don't know where you are. You can't necessarily make a lot of noise. When
I say sound like, I meant in your head.
What would it sound like in my head?
I assumed it was you were thinking.
Like
what would you be saying to yourself?
Well, it's not really a verbal thing, but like I'm making like eye contact with my partner and like finding like a like kind of like a high energy, like this is going to be fun type of smile. There's just kind of like this like moment of connection, and they're like, okay, we're doing this.
Sure.
Type of thing. And then there is like a physical like handshakey type ritual that we do.
Yeah. Well, very good. And so, and the thing about that's nice is it's before the performance. So whenever you do that, there's a likelihood that it's going to be very positive. It's going to be a positive environment around you. And then you're going to have that particular, set of interactions that are going on. So you're kind of like bringing in all that positive association. So for instance, if you were to disclose that to me, and then we were taking the performance situation from the time, that just before you went out there and performed, you would, be disclosing to me, like you'd be saying, okay. And I look at my partner and I just kind of look at him, and we just look at each other, and we just know that we're meant for each other. We got this going on together. You would say something like that, right? And then I would be there kind of piggyback, and I'd say, that's absolutely right. This is like, if you think about it, this is just a wonderful experience that you're going through. So I'm just kind of reinforcing and kind of, complementing the things that you would be having.
Yeah, that makes a lot of sense. And kind of piggybacking too on what we were talking about of like the coach giving feedback thing, like I think like trying to build that kind of positive association with like all sorts of touch points you have, right? Like, feedback after doing a skill, or even just like preparing to do a skill with a partner.
Exactly, because if you're emphasizing the positive, that person's going to find that positively refreshing. They're going to enjoy it. You're going to be associated with positivity. If you're going in and just describing the things that someone's not doing right, then you get all that negative mojo going in with it. It just kind of upsets the balance. And so if you're a coach, don't you want to be associated with being a positive influence that is going to get a lot of And I'm not suggesting that the person, the coach, doesn't go ahead and really deliver that information that's important, but rather just do it in a timely way. First, what did you try to solicit from the artist? What did the artist think was done optimally? And then what does the artist feel could be optimized? And then, hey, here's what I liked. Would you like to hear, something that I've got here that I think could, then that establishes a partnership. Yeah,
it establishes rapport. There's a sense of agency. One of the things I found very interesting is just in practice design, they've consistently seen better outcomes. Like if you're giving athletes like just a little bit of choice of like when to move on to the next drill, or any number of things there. There are kind of a couple other points that I want to hit. So I think the first is just like if you're, like you very much focus on like this kind of like performant athlete crowd, but are there any like specific like drills, exercises, or skills that you were just like, I think the diaphragmatic breathing is a great example of just like, every single person, like general population, like would really benefit from like, doing these things or think about things in this way?
Yeah, let me think here. So, we do appreciations, speaking about relationships, where basically we have, if we have a group, we'll have them in a circle, or we'll have them facing each other in two lines. And basically, one person, if it's two lines facing each other, let's say one line goes ahead and starts and initiates what they appreciate about the other person. And then that other person usually says thank you, and then reciprocates what they appreciate about the person. And, especially for relationships that have gone on for a while, you start to see a real enhancement in their relationship. And it seems so simple, but it's terribly important. We see a lot of times watery eyes, especially if they've known each other for a while. And also, especially if they've experienced difficulties. So you can imagine like when I went to CAW, that was one of the things that they really loved the most, right at the beginning, is that we started to do that. And it immediately diffuses a lot of upset. It immediately validates that the person's there for them and so forth. So that's one exercise that we could do. We also did some basic communication, like, if I want you to do something, there's certainly ways that I could, ask you that's going to increase the likelihood that you'll be more likely to want to do it. And so we have a number of different steps that we also work on to develop skills in communication. And some of those things are like just saying, making a specific request, starting with please, and telling when you want it. Usually it's a now. So please, can you pass the sugar now? Or whatever that might be. Please, can you talk to me more, when you start to get upset? Whatever the query is. And then there's certain things you could do. Like you could say, well, I would really appreciate it if you did do that. I could help you to do that by doing such and such. If you have an alternative, maybe we could do that. So there's certain things that you can do, and we have all these things listed out. And again, if they just go to topscience.com and just ask, I'll provide these handouts. They're worksheets, and we actually practice them. So that they could get better in communicating the things that they that they desire. trying to think of some other, positive exercises that we've done. We have a lot.
I was one of the other things that you kind of talked about in your talk that struck me was this kind of like visualization exercise with like colors, just as like a pain management thing. But I imagine that would also help with general proprioception.
Yeah. So there's not as much evidence on color therapy, but basically there is some. And one of the things that's really cool about it is it's very simple to do. So let's just say that I injured my elbow and and there's some pain there. Well, what I really do is I just sit down, I go through the relaxation exercises that we talked about before. Once I'm in a relaxed state of mind and I'm breathing, diaphragmatically, then I just focus intensively on my elbow. And contrary to what people try to do with, they oftentimes try to avoid thinking about that pain.
Right.
We actually have them focus on that pain and match a color to it. So we say, okay, I'm feeling my elbow and it's red and it feels very painful. I'm focusing just on my elbow. It's red and it feels very painful. Right now I'm feeling a lot of pain and it's red. And then they kind of switch into, say, a neutral color, white. My elbow is now white, and it's not. There's little pain, but it's also it doesn't feel relaxed. It's just kind of there. It's white. It's neutral, and I'm focusing on my elbow, and it's white. Now it's turning blue. I'm focusing on my elbow, and I'm starting to feel. I'm changing it to actually feel a good numbing kind of sensation, and it's feeling good, and it's blue, and you just keep matching those things. And so that's a strategy that a lot of artists could use, if they were starting to notice that the pain was coming in. So they focus on it with the red, they go to neutral with the white, just kind of it's just there. They're just focusing on how it's neither painful nor calm, and then they go to the blue, which is they're actually changing it to become calm or just there and feeling comfortable.
Yeah. One of the other things I really wanted to kind of ask you about is this kind of like notion of identity and the things that go into it. I've noticed, recreational acrobats, professional performers, athletes, like a lot of, or just like a normal person who has like maybe a high stress job, like a lawyer or a doctor or something like that becomes a significant component of their identity. And then something happens like an injury where they're not able to engage within it as fully. So in addition to like maybe temporary loss of livelihood, you're also like, this part of you is this kind of inaccessible. Yeah. And I've certainly like found some success where like, I have wrist surgery. I'm going to focus on like some other things that are going on. And even apart from that, I'm like trying to cultivate, a life with like lots of different pillars of identity and meaning. Is this, do you focus on, do you do any kind of like identity related exercises with people? Do you have, just any thoughts on that at all?
Yeah. So what we do on that is we address that through culture. Yeah. So if you think about it, an identity is reflective of a culture, usually, and so you can think about people, they have various types of cultures. We certainly have ethnicity as a culture. We have gender as a culture. We have, being an artist as a culture, being an athlete as a culture, and so what we do is we'll talk a lot about, the importance of that culture, have the person actually, hey, tell me a little bit more about, like we actually have a questionnaire that we'll administer, and then they say how much they agree with these statements. And the statements are things like, my culture is a big part of my life. My artistic culture or my being an artist is a big part of my life. And, I've experienced rude or offensive remarks due to being an artist, as an example. If I was pursuing performance programming, I would want to have my being an artist, address, so we'll go ahead and ask, tell me a little bit more about how being an artist is a big part of your life.
Yeah.
And then they tell you, and you just kind of listen to them and, acknowledge, the things that they're saying and really appreciate and understand where they're coming from. And that's very almost like an important first step if I was working with someone. Yeah, and not only rapport, but also their assurance that I'm appreciative of where they're coming at an intimate level, where they've really had a chance to disclose, all those things about that identity and why it is important, how it's a big part of their life. How they've experienced rude or offensive remarks, or that, maybe they feel judged or, whatever. And then once they do that, then the key is to try to expand other cultures or other identities that they might have that they haven't grown into as much. And so you see this with sports and being an artist, of course, as they get older, they can't do the same, acts. So what do? They kind of reinvent themselves and do something a little bit different. But even that, after time with, going through these processes for so long, they want to do something different, but that becomes very difficult because they're so enmeshed in that, in that culture, that identity. So what we try to do is almost a preventative. We want to, from day one, really understand, how they are as an artist, with their identity, really understand their culture behind that, and give myself the opportunity, as an example, to let them know that I do appreciate it at that intimate level. And then once that happens, then we want to go to the next step, which is to introduce other aspects of their life. And so we focus on relationships, school, if perhaps that's something they want to do, another type of work, or maybe something that they've done in the past that's different, from their identity. We go with creativity. Because creativity is not just for art, it's for lots of other things. Yeah. And so we try to expand that, and we try to look at mental strength and stability as more of a concept that how do we expand that? And so if you think about those various domains, they're very important to pretty much everybody. And then they start to talk about how those things are important, or what are the different things that they would like to do along those lines. And then they try to, expand on that. And so if you have a lot of different types of identities or cultures, you're not fixed in or boxed in, or you don't feel pressure, to just do that. And I think that's, something that you could do individually as well, right? You don't need someone working with you necessarily. You can kind of examine yourself. What do I appreciate about my culture? What do I appreciate about my identity, where I'm at? And then, okay, what are the other areas of my life that I'd like to expand upon?
Yeah, and doing that in the first meeting or proactively, it becomes integrated better. And I feel like it's going to make someone far more resilient to injury than definitely. If they're injured and it's okay, now what do I have left?
That's it, right?
Yeah.
Yeah, definitely. Yeah, and it's a beautiful thing, right? There's just so many opportunities in the world, and especially with artists, they have creative minds that, they've been bred to, to have creativity developed and relationships. If you think about it, artists are exceptionally good with their relationships. And so we want to really expand that and kind of network and, go from there.
Yeah. What are some kind of, misconceptions or obstacles related to, the way people perceive, I would say performance psychology?
How they misperceive it?
Yeah.
Well, I'm not really too sure. I've never really talked to people about that. I think it's an excellent question. I can only imagine that, a lot of people think of performance psychology as, you pursue someone, that does that when you're experiencing problems. And, I'd like to see people, pursue it when they're really just trying to optimize wherever they're at.
Right.
And to feel comfortable with that, and to know that those programs exist. And so that's what I would probably guess.
Or maybe just like stereotypes people have about like working with like a psychologist in any capacity, or like maybe traditional talk therapy, or like how what you're doing like differs and can kind of meet people in a different way.
Well, I think if you think about it, like we all have areas of our life that we'd like to enhance or optimize. I mean,
Sure.
who doesn't, right? And we can conceptualize them as problems or deficits or weaknesses and so forth. Or we could talk about the process of optimizing wherever we're at. And if you think about the optimization of where we're at, that's a lot less stigmatizing.
Right.
That's a lot that brings in a lot more positive energy. If someone comes down to our top center, no one knows why they're coming in there. You know what I mean? Like they just know that there's someone that's coming in to try to optimize. But imagine going into a more traditional, therapeutic place, and they might go in. If someone sees that person, they're going to make an assumption. Oh, that person must have something going wrong with them. And people don't like to pursue therapeutic programs when there's that risk. A lot of people. Now, some people are just really confident and they
Sure.
they don't, or maybe they've been raised to appreciate, those kinds of things, and that's a good thing. But, but a lot of times they don't. So I would say that's probably the biggest thing, I think.
Yeah,
it could be
for
misperceived.
Sure. One of the other things that kind of I noticed about your work was you had this HERD framework.
Oh, yeah.
Can you maybe go into a little bit of detail about that?
Well, yeah, and I appreciate you bringing that up. So Al Light, that's his favorite one at CERC. When we went in, to help, CA to as a company, HERD was one of the most important, strategies that we brought to CA. And what it is it makes it very easy to respond to someone when they're upset. And see, a lot of times people want to just give you the answers, they care about the person that has the problem. So they just want to help them, want to give out the information. And a lot of times what happens is that person that's receiving it may not be ready for that, or, they may not feel that they have the skill sets or the energy to do the things that are being asked. Sometimes if you come in with suggestions about what you think that person can do too prematurely, they might even think that you don't understand them, and that could actually hurt your rapport with them.
Yeah.
So there's a lot of that going on potentially if someone's experiencing upset. So what we did was we developed the strategy where the H means here. So someone comes up to you, they're upset, they have a problem, they're getting a divorce or whatever might be going on. You hear what they have to say. Then you empathize with them. A lot of people skip the empathy part, but it's really important. Mm-hmm. It's not stated just because you feel sorry for them, but you state it because you want to let them know that you've heard them and I appreciate where you're at. Yeah. And then after they do the E, the empathy, then you ask the person what kind of things do you think could help you, or could help you to achieve your goals in that area. And then you review what's good and bad, or about those choices that the person throws out. And mind you, the person that's doing this, that's facilitating it, has not said anything other than supportive comments. And then after they review, then the D comes in, decide. What do you think you want to do about it? And, similarly to what I was saying earlier, the majority of the time, they know what the answer is or what they want to do. So that's always going to keep everything in check. And then I just simply, say, is there anything that I can do to help you with that? And it makes it a really easy process. So when I'm doing it, I actually have that acronym in my head. Right. And so I'm going H, the E, A, R, D, and and what each of those things represent. It gives a sufficient time too to really appreciate where the person's coming from. And you could do that. The person's having a difficulty with injury management. The person's having a relationship issue with their partner. They're experiencing a stuck point in an act. You could use it pretty much in any way.
Yeah. I want to give you an opportunity to talk a little bit about really anything you want to talk about with the TOPS program, how people can get involved with that or learn more.
Yeah, anybody that's interested, all they have to do is type in on the internet topscience.com with 2 P's, because it's the optimum. The optimum performance program in sports. So TOPS, and then we have science afterwards.
Yeah,
so,
and we'll have the link in the description.
Yeah. And so that's all they have to do. And there's a lot of great resources there. We took the time to come up with some beautiful videos that show how to do diaphragmatic breathing, show how to make positive requests, how to, one of them is even on intimidation with Forrest Griffin, the UFC guy. Mm-hmm. But what we do is we talk about using that in a way that's safe, that doesn't involve me acting upon someone else, but really keeping my confidence really high as an example. Not so much relevant to artists, but, for more, someone that's watching your show that's, that's looking into arts. But yeah, there's videos, there's worksheets, there's a hotline number that they can call, which essentially ultimately gets over to me, and then I could help them out with, just basic kinds of things. And, great resource.
Awesome. Yeah. Are there any other last topics that you'd like to touch on today?
No. It's been a pleasure talking about it. Great questions, and real good stuff.
No, I very much appreciate you taking the time out of the day here. Really appreciate all the insight and the experience you've had. Really, just with such a unique population. Yeah. Like circus artists are we're definitely athletes, but the considerations are just so different from like your traditional football player or boxer or something like that. So just hearing about your experience and all the evidence-based tools you have, really, really appreciate that.
Yeah, I appreciate it, Ben, and love the podcast. It's fantastic. But thanks again.
All right, thanks.